guys, it's Brittany, and today I want to talk to you about PCOS, what it is, because not only do I deal with PCOS, but it is one of the most common misunderstood topics when it comes to infertility problems. So I kind of wanted to explain the definition and how it affects my life, and maybe this can help you guys out. And I will be looking back and forth at my computer because I have made some notes. Just like in high school, I struggled with speech. I struggled with remembering things off the top of my head. So yes, I do know a lot about PCOS, but not all of the information. I'm learning just as much as you are. So let's dive right in. What is PCOS? PCOS stands for polycystic ovarian syndrome, and it is the most common metabolic abnormality in young women today of reproductive age. It does affect about 7% of women in the reproductive age. PCOS was originally described in 1935 by two doctors. I find it very strange that two doctors discovered this in 1935, and I just learned about PCOS within the last 8 to 10 years because it's not talked about. And a lot of women suffer and they don't know what's wrong or what's going on with their body. I'm one of those women. I am a soul sister. I am trying to figure it out as I go along myself. I really struggled for years because I didn't understand what was going on with my body, why I was so tired all the time, why I was in pain, why I had all these different symptoms, why I had symptoms of pregnancy even when I wasn't pregnant. Even before I was sexually active, I had these symptoms and I just had no idea what was going on. Doctors typically diagnose women with PCOS if they have 2 out of 3 of these symptoms, and that would be high androgen levels, irregular menstrual cycles, or cyst on their ovaries. A pelvic exam can look over any problems with your ovaries and any other parts of your reproductive tract. You can also do blood tests, which I highly recommend because it does check for higher than normal levels of male hormones, which is why a lot of women with PCOS deal with the excessive facial hair or body hair. You might also have blood tests to check your cholesterol, insulin, and triglyceride levels to evaluate risks for related conditions such as heart disease and diabetes. And lastly, I do highly recommend an ultrasound because it uses waves to check for abnormal follicles. Some signs of PCOS would be high levels of androgens in women. So you will notice more acne, inflamed skin, hair loss, increased body and facial hair, and infrequent or missing menstrual cycles. PCOS has been linked to insulin resistance, and many PCOS women, obese and non-obese, are insulin resistant. Insulin resistance is believed to play a prominent role in this syndrome. And it's a predisposition of, I am totally going to butcher this word, but hyperandrogenism. And also other problems with your ovaries and uterus, such as missed periods. That is a big sign right there. If you have a missed period and you're not pregnant, if you've been trying to get pregnant for more than 12 months but have been unsuccessful, if you have symptoms of diabetes such as extreme thirst or hunger, blurred vision, or unexplained weight gain. Another symptom of PCOS would be anovulation. So anovulation just means you lack or there is an absence of ovulation caused by hormone imbalances. I myself deal with that because I do not have a menstrual cycle on my own each month. I do have to force a cycle. So if you do not have a cycle, you do not ovulate. If you do not ovulate, you can't get pregnant. That is the biggest symptom that I have with PCOS. Another symptom would be the fluctuating weight. I gain weight and then I lose weight and then I just can't keep it down. Very discouraging at times, but I know that I'm trying my best. Another sign of PCOS would be, again, gonna butcher this, it's hyperprolactinemia. It is a condition where you have too much prolactin in your blood. The main function of prolactin is to stimulate breast milk function after childbirth. Another symptom would be hypercortisolism. I think I said that correct. You may have heard it as Cushing's syndrome. What that is, it's a disorder with physical and mental changes that result from having too much cortisol in the blood for a long period of time. Yes, I keep looking down because I am reading my notes to make sure that I am not giving you false information. Darkening of skin. I do not have this symptom, but I do have friends that do have this symptom, and a lot of the times you will see the darkening of skin in certain creases of your body, such as like your arms. A lot of the time it's on your neck. So that is what I mean by darkening of skin. So how do you get diagnosed with PCOS? First step, do not go on WebMD and diagnose yourself. Definitely go to a doctor. He or she will run a series of tests, blood tests, pelvic exams, and vaginal ultrasounds. Again, do not try to diagnose this yourself. A big question that I've been asked on multiple occasions is, when should I go see a doctor? Well, I don't want to tell you what to do with your life. I don't want to tell you anything because I am not a doctor, but I would recommend seeing a doctor if you have any symptoms of PCOS. So I've been asked, what are the most common medical treatments for PCOS? Now I will have to look at my computer because I did jot these down as I cannot remember all of them. Birth control. Birth control pills and other medicines do help regulate a cycle, which then helps with not only your PCOS, but ovulating. I know a lot of women might look at me funny because they have PCOS and also trying for a child. So why would you take birth control? I've thought the same thing on several occasions. When you take birth control, you are taking estrogen. So that can help restore your hormone imbalance, regulate ovulation, relieve symptoms such as excessive hair growth, and protect against cancer. These hormones come in a pill, a patch, and a vaginal ring. You may also take metformin, clomiphene, letrozole, or another medication similar to those three. I have taken all three of those. Not so much metformin, but I will be taking it with my IVF cycle. You may have heard of metformin before. It also treats type 2 diabetes. It treats PCOS with improving the insulin levels. Clomiphene, metformin, and letrozole are all three medications that help ovulate. So you take them most likely on day 3 to day 5 of your cycle. Depending on your protocol, you may take them for 5 days, up to 10 days, and that should help you ovulate. When it comes to facial hair or body hair, there are medicines that you can take to help with that. There's also the laser hair removal. Surgery can be an option to improve fertility. However, in my opinion, I think it would be best to talk to a doctor first because there might be other options that you can do before surgery that may also help save some money, such as medications, acupuncture, chiropractic help. I'm sure there's more, but I would always just double check with your doctor to see what he or she thinks first. But if you did go down the route of surgery, I have heard of ovarian drilling. I've never had it myself, but ovarian drilling is a procedure that makes tiny holes in the ovary with a laser or a thin heated needle to restore normal ovulation. So the bottom line is that PCOS can disrupt women's menstrual cycle and make it harder to get pregnant. Lifestyle interventions are going to be the first step that a doctor is going to recommend with treating PCOS. And then if that doesn't work well, you would probably go down the path of different medications, possible surgery, and things such as IUI or IVF if you are trying to get pregnant. Come on, hurry up. Hyperandrogenism.